Hi everyone, this is board certified plastic surgeon Sean Doherty in Boston, and I'm continuing my discussion today on facial rejuvenation. So the patients that come to see me and ask about things they can do for facial rejuvenation, here are the 4 things that I think about when we discuss those options. 1 is the quality of the skin. Number 2 is the descent of the skin, so the sag. 3 is volume loss. And 4 are lines in your face. So we've already discussed some of those, and today I'm going to talk about the lines on your face. So these are static and dynamic lines. These are lines that are accentuated by facial muscle movement, and those are dynamic lines. And so the more dynamic your face is, the more active you are, the more you use your face to express and emote, the more you're going to have those lines. And for some people, that's more aging than others. And then for those of us who have been doing these types of things for many years, those dynamic lines end up becoming static lines, meaning that even when I'm not moving my forehead muscles, you can still see these lines right here. So when I was studying in medical school and doing kind of this when I was reading, had I had medicine that softened those lines, I might not have these static lines today. But then I wouldn't be able to talk about them and use myself as an example, right? So how do you treat these? These are lines that are treated with neurotoxin. And what's a neurotoxin? Botox or Dysport are medicines that I inject with a needle into the skin that relaxes muscle. And when you relax muscle, then the skin that's attached to that muscle is less dynamic, doesn't move as much, i.e. doesn't create a line. So we don't inject something to fill a line per se when these lines are dynamic and static. I instead think about relaxing the muscle. And some people would say, well, then just fill my face with Botox. I don't want anything to move. Well, that's not really the most attractive aesthetic thing. We want to have some facial function, and that is how we emote, that's how we communicate with others, that's how we show our personality, but we want to maybe soften the aging aspects of those. So areas where I inject Botox and Dysport are here. These are for the crow's feet, and for purposes of this video, I have absolutely no neurotoxin on my face, so I have full function. So these lines right here can be aging. So if you relax the muscle that creates these lines, it softens this, so I can't do that quite as much. You can kind of see how that's improved there. And the secondary benefit of injecting this area, which is called the crow's feet, is if I relax this muscle, then the muscle that holds my eyebrows up kind of takes over and actually lifts your eyebrows up. So you have a 2-for-1. You relax these lines here, and so that's less aging, and it lifts your eyebrows up. Both men and women have problems with kind of heavy brows that age and even kind of close their eyes. So both men and women benefit from Botox and Dysport in this area. You have to be careful about asking someone about injecting neurotoxin in this area, because if you're concerned about a bag or sagginess of the skin, ultimately that is a surgical procedure, not necessarily neurotoxin. The other area is the glabella, which is a muscle here called the procerus, or corrugator, and the contraction of those 3 muscles kind of creates these vertical lines. Some people call them the 11s, some people call them the 111s if you look at me. And so relaxing this area can actually open up the center of your face, soften that, and not allow you to make these muscle function, then not to have those lines. That is rejuvenating to your face. And actually for some people who hold their tension here and actually even kind of get stressed and hold their muscles tight, report an actual benefit of lack of headaches when they get neurotoxins in this area. So that's a beneficial medical side effect from a cosmetic procedure, which is actually kind of awesome. And then lastly, injecting the forehead can relax the frontalis muscle, which the muscle is in this direction here. It's the muscle that's connected from your eyebrows to your scalp, and it's what holds your eyebrows up. So those of us who kind of lift our eyebrows up a lot because they're naturally heavy tend to have more lines here. So I talk to patients and other physicians about the challenges of injecting in your forehead, because everyone wants to have a smooth forehead, but they need to realize that that frontalis muscle, which I just spoke about, is necessary because it allows you to lift your eyebrows up. So you kind of can't have your cake and eat it too. You can't have a completely smooth forehead and still be able to move your muscles. So you want to seek out a medical professional, injector, or a cosmetic specialist who understands this anatomy and understands the complexity of injecting either Botox or Dysport to this area. Other areas where lines can be bothersome are on the upper lip. Botox can soften that and so can smooth out the pursing of that. Sometimes around the chin where there's some dimpling, people compare that to, say, an orange peel. Botox there can be softened. There's pulling on the corner of the mouth with a muscle here called the depressor anguli oris. Injecting here is a way to smooth out the corner of the mouth. And then people who are bothered by platysmal bands and feel that that's aging can have Botox injected there. The nasolabial fold and the jowl are not Botox areas. The mid-face is also not a Botox area. That's more of a volume area. So Botox and Dysport can be injected in the office. It has minimal discomfort. It takes about 15 or 20 minutes. I ask my patients not to exercise afterwards, and there's minimal discomfort. There's a risk of bruising, unfortunately, like any procedure, so you want to schedule that at a time when that's appropriate for you. The goal is for you to not be bruised at all. It takes about 24 to 48 hours to start seeing the effects of it, and it takes about 12 to 14 days, I think, to see the peak. So you would certainly want to plan something like that way before an event if you want to have the effects of the neurotoxin for that event. And I hope that was helpful. And we'll continue this discussion about facial rejuvenation. Please check out my Instagram, my website, and my YouTube channel. This is Sean Doherty from Boston. Hope that was helpful. Thanks.